All right, let's take a deep dive into the COVID numbers, the third wave, and what we're learning about the variants and the impact of the vaccines. I'm joined now by Chief Commercial Officer from Discovery Health Group, Dr. Whelan. He's also a medical doctor, and he knows exactly what the numbers mean as he heads up the COVID team at Discovery. Ron, thank you so much for your time this evening. You know, we've obviously been tracking the COVID numbers and what they're telling us, as I'm sure you have. We see this evening they're up over 21,000 nationally, and if we look at the last few days, you know, yesterday was 15, before that was 12, then it was 16, and it was really high before that. So there was a sense maybe we're coming off this third wave, particularly in Gauteng. But with over 10,000 infections in Gauteng today compared to over 9,000 yesterday, are we through that third wave yet here?
Well, firstly, good evening to you, Sally, and good evening to the viewers out there. Hoping we can help demystify some of the numbers this evening. I think the first thing worth mentioning, Sally, is we've got to look at the daily numbers cautiously. So daily numbers are often impacted by some of the reporting cycles on a day-to-day basis. So what we look at Discovery is on 7-day moving average basis. And what we're trying to discern from that is upward and downward trajectories and trends. And when we look at the 7-day moving averages across the different provinces, we see Gauteng tracking at around about 10,500 to 11,000 infections daily. As you rightly mentioned, KwaZulu-Natal is beginning to pick up into the 1,200 infections daily mark. Quite concerning, the Western Cape is picking up to sort of the 2,000 mark. And looking at those numbers, we measure those numbers on a per population basis, what we call an attack rate or an incidence rate. The attack rate is the number of new daily infections per 100,000 population per day. And I think that's the number we've been tracking all along. Gauteng, as you rightly mentioned, is in a severe third wave at the moment, with an attack rate of over 70 new infections per 100,000 population per day. I can tell you that that's double the second wave attack rate.
Sure.
South Africa is now towards an attack rate of 30 per 100,000 population per day. That's equivalent to the second wave outbreak. So we're certainly seeing increasing attack rates and very high attack rates in Gauteng in particular. What we also look at is the slope of these curves, Sally, and I think that's really important. That gives us some sense on whether we're cresting or not. And I can tell you, when you look at the Gauteng slope of the curve, we have seen a slight tapering off over the last week or so. So we've moved from a compound daily growth rate of about 4% per day down to 2% per day. So that suggests that Gauteng is starting to crest, and that would be quite well correlated with what we saw in India. You'll remember that India had a big outbreak a few weeks ago, also caused by the new Delta variant. We see the Western Cape numbers are roughly flat at about 4% compound daily growth rate, but KZN really beginning to pick up at about 7% compound daily growth rate. And for the viewers out there, just to help you convert that compound daily growth rate into a doubling time, if you've got a compound daily growth rate of about 5, it means that every week the infections double. Compound daily, every 2 weeks the infections double. So we're seeing doubling times of about every 2 weeks at the moment.
And it's interesting you mentioned KwaZulu-Natal, because the government there has just sent out a press release saying KwaZulu-Natal issues COVID-19 warning as 5 districts cross the third wave line, and they are really concerned. The other measure is the reproduction rate, and that's the speed at which the virus is passed from one person to the other. Now, I listened to a presentation from Ryan Noach, which was done, I think, on the 1st of July. He said at that point that Gauteng was on 1.3. It had come down off 1.6. Anything above 1 is pretty much exponential. Do you have any latest reproduction rate figures for Gauteng that would perhaps show us that indeed, despite some worrying numbers, we might be over the worst?
Yeah, well, so Gauteng's reproductive rate is currently still sitting at 1.3, so it hasn't moved in the last week or so, and I think it speaks to that cresting that I spoke about a little bit earlier on. The Western Cape reproductive factor is 1.3 at the moment, and KZN sitting at 1.4. Nationally, we're sitting at a reproductive factor of 1.21. And as you rightly mentioned, Sally, well, anything above 1 means that the virus is continuing to spread across our population. So we must get that reproductive factor below 1. So long as it's below 1, it means that we're containing the spread and proverbially flattening the curve. I think what's also important to mention in terms of reproductive rates, our discovery actuaries have done extensive analytics on what we think the level of infection has been across the country over the last year or so. And what we're finding from that and from those analytics is that we estimate that over 92% of people in the Eastern Cape have already been infected with COVID. We're not sure which variant they were infected in. We obviously don't have that data. 88%, we estimate that 88% of people in KwaZulu-Natal have already been infected with COVID. When you compare those numbers, 88% to 92% to Gauteng in the Western Cape, Gauteng is, we estimate 45% infected with COVID prior to this third wave. Western Cape, 50% prior to this third wave. So that suggests that KwaZulu-Natal, as well as the Eastern Cape, built up reasonable levels of population immunity against COVID. So we would have expected slightly lower outbreaks in those provinces. Obviously, concerning that KwaZulu-Natal is growing now. It may be as a result of the new variant. I think that definitely explains what we're seeing in Gauteng and the Western Cape in particular.
Yeah, that's right. And I think all those models worked until Delta came along and just messed everything up. And I mean, this is the thing about the virus, is we simply cannot predict at times. And this is why the vaccination issue is so critical, because the more people that are vaccinated, to my understanding, the less that virus passes through the population, the less it's able to mutate and develop these very concerning variants. Let's dive into what we know about vaccines. We've seen in countries like the United Kingdom that they have effectively broken that link between infections and hospitalizations. They've got a spike in infections, but there are not many people in hospital and sometimes still 0 people dying every day. They've effectively broken that link. They still obviously have to be very, very cautious. That seems to be the case in a lot of countries that have now been vaccinated. There's one exception, which is Chile, which is really, really interesting. Just tell us why Chile doesn't seem to have broken the link as effectively despite vaccinations.
Well, you're exactly right, and I like the way you framed it, that you've broken the link in infections. What we see conclusively across the UK, the US, and indeed Israel, where vaccination rates are high, particularly in elderly populations, is as soon as vaccination goes up, infection levels go down. As soon as vaccination goes up, deaths go down and hospitalization go down. So there is very clear and compelling evidence for the efficacy of vaccines now globally. Chile, as you rightly mentioned, is an interesting example. So Chile had a very good start to their vaccination program. Vaccinations went up and a significant portion of the population got vaccinated. But infections stayed relatively flat. And in deaths came down a little bit in the Chile program. We're still trying to understand exactly why that played out. One of the reasons for that may be that Chile, in comparison with the UK, the US, and Israel, used the Sinovac vaccine, whereas the other countries, Israel used predominantly Pfizer, the UK used Pfizer and AstraZeneca, and the US obviously built their program on the back of Moderna and the Pfizer vaccine. So we think that part of the reason Chile has seen slightly less impact of their vaccine program may be because of the vaccine that was used there. As I say, early days to confirm those findings, but certainly something worth watching.
Yeah.
I think what's also being investigated in Chile is obviously different variants in Chile, to see whether variants are playing a role there. And then finally, underlying herd immunity in Chile maybe playing a role as well.
Yeah, it's interesting. I mean, the new variants, we're all talking about Lambda now. We've been told is absolutely not present in South Africa. This is the variant found first in Peru. We are hearing that the vaccines we have would anyway be effective against us. Talk to me about what you've seen around the effectiveness of vaccines here in South Africa with the rollout through Sisonke, but also to Discovery members. What is the most exciting stuff that you are seeing that makes you feel this is absolutely what we have to push for now?
So we've just done a very interesting piece of analysis of Discovery led by our research and intelligence team at Discovery Health. And what we found out of that analysis is that we're seeing a 47% reduction in infection risk 21 days after the first dose. So after you've had your first dose of the Pfizer vaccine, bearing in mind that the Pfizer vaccine is the dominant vaccine in use at the moment, you see a 47% reduction in your risk of infection. Related to that, we're also seeing a 50% reduction in hospitalization for those folks who do end up with a breakthrough infection. I think that's very exciting. When one considers a 50% reduction in hospitalization risk, 47% reduction in infection risk, that's a measurable improvement in populations that have been vaccinated so far. And I think are very exciting, particularly in the age groups that have been vaccinated. So people predominantly over the age of 60, and then obviously starting last week, we're now vaccinating people over the age of 50 as well. So that's very exciting. I think the second very exciting news here globally, and the data is still emerging on this. Up until this week, we were seeing very good second dose effectiveness, particularly out of the US, the UK. So after the second dose of the vaccine, seeing up to 88% reduction in infection risk and up to 96% reduction in hospitalization. There has been, I think importantly, there have been some reports out this week suggesting that those may be a little bit lower than we've seen in the initial studies, but nonetheless, I think are just outstanding results.
Yeah, it's such a hopeful news, and yet we see vaccine hesitancy. So many conspiracy theories, so many rumors going around. I mean, one of them is, will it make me infertile? Yes or no?
A simple answer.
No, right. The other thing, I mean, for me, the only thing that really resonates at all is the fact that these vaccines have had to be developed so very quickly. We haven't had a chance to see in the real world a long period of testing. How do we know that in 5 years' time we won't suddenly say, oh my word, this vaccine that everyone got actually has now done this to us? We don't know, or do we?
No, but I think the first thing is that we've been developing vaccines for decades now. So we're well versed in vaccine development globally. Vaccines are developed by some of the biggest companies globally, by the leading scientists globally. There is a rigorous testing process for all vaccines. The trials are just unbelievably rigorous and challenging to get through. And I think that gives us a lot of comfort that these vaccines have certainly been trialed and tested and have been proven to be both safe and efficacious. Remember, you want vaccines that are both safe and efficacious. And I think what's also been Go ahead.
Sorry, I'm just running out of time because we're keeping an eye on what's happening around Jacob Zuma. But I have to ask you about long COVID. This is something that, is a real concern. And it's something that it's the lag, it's the long-term impact on individuals with long COVID. Some quick-fire questions. Is it a recognized illness at Discovery, long COVID?
Yeah, it's something we're very concerned about at the moment.
Right.
I think it affects what we call the cardiometabolic system. So it affects both your heart and your metabolic system. One of the things we found at Discovery over the last year, several months of research, is a 2.75 times higher risk of diabetes on the back of COVID. So if you've had COVID previously, you're at increased risk of diabetes.
I'm jumping in there. I'm jumping in there because that is so startling for me. It's not just unmasking an underlying condition that you might have anyway gone on to develop. You're saying that if you develop long COVID, you have a 2.7% increased risk of getting diabetes or a heart disease.
So 2.7 times risk. Yeah, so you're almost 3 times as more likely to develop diabetes than the regular population if you've had COVID. Yeah, so it's a significant risk and something we're particularly concerned about. In many respects, we're already in a diabetes pandemic, and now COVID has really potentiated that risk. In addition to that, we're seeing significantly higher risk of heart disease, so hypertension and ischemic heart disease. So we're seeing COVID has a significant impact on your vascular system in particular. I get a lot of questions around vaccines causing clots. I can tell you that COVID causes many more clots than vaccines would ever produce. So significant impact on the vascular system. And then indeed, we're seeing some very worrying signs around COVID's impact on the heart. We call it inflammation of the heart, otherwise called myocarditis. And we're seeing inflammation of the heart in about 60% of your patients after COVID. So I think very concerning trends and patterns for us to watch over the coming months.
I think it just highlights there's still so much that we're discovering about COVID-19. Just to end on long COVID, do we have data yet on what proportion of people who get COVID will go on to develop long COVID?
The data is still emerging, and we're obviously tracking this closely from a diabetes perspective, from a mental health perspective, and from a cardiac perspective. We're still, as you rightly mentioned, in the early stages of the COVID journey, and tracking these patients over time now. That data will continue to emerge over the coming months.
Very quickly on vaccines, we're seeing quite a nice uptick of daily vaccination rates. I think we're over 160,000 in the past day or so. There's calls now for the over 40s for it to be opened up. Do we have enough vaccines to do that? Do we have enough manpower and vaccines to absolutely open the floodgates at this point?
Well, I think we actually delivered 180,000 vaccinations yesterday, which is very exciting. That's the peak of our vaccination program so far. It's a collaboration between the public sector and the private sector, and there's sites across the country that are really beginning to vaccinate at pace. We're seeing some of these bigger sites emerge as well. You'll notice we, as Discovery, launched the Cape Town Convention Centre yesterday. We're up and running at Gallagher Estate, and these are really adding to the vaccination capacity. You're right to say we are concerned about the supply forecast for July. So we had very healthy supply of vaccines during the latter part of June, and those vaccines are currently being distributed across the system. We are a bit leaner on supply for July. So predominantly Pfizer doses scheduled for July, 2.1 million doses scheduled for delivery. But we are working extremely hard with your partners at J&J and at Pfizer to see whether we're able to front load some of the supply from the latter half of the year. You'll know that we've got many vaccines scheduled for Q3 and Q4 in 2021, so 30 million doses of Pfizer, 30 million doses of J&J in total during 2021. I want to bring some of those doses forward, if at all possible, to continue vaccinating at this pace during the course of July.
Yeah, and with everything you've told us about long COVID and just how effective the vaccine is at keeping people out of hospital and stopping people dying, absolutely critical. Thank you so much for sharing with us your very latest data. That, of course, is Discovery Health Chief Commercial Officer Dr. Ron Whelan, also head of the COVID task team within Discovery.